when we do breast augmentation, we have to decide where we're going to put the implant. And the two most common places are above the muscle or below the muscle. The under the muscle is the most common in North America. A couple of reasons. One, especially in a thinner woman, it gives you some more thickness and coverage at the top, so there's a smoother transition from the collarbone down into the breast. That's also really important over time because as tissues ultimately change and even stretch, especially in years to come with weight loss, the top of implants can become more visible, and that will certainly lessen the chance of that if it's covered by that muscle. The other reason for putting it under the muscle is, at least historically, there's a lower risk of developing abnormally tight scar tissue compared to on top. Now, that I think is a less important reason because I think our techniques have changed enough that that's less of a factor, but certainly something we have to consider. The disadvantage of going under the muscle is that you can develop what's called an animation deformity, or movement of the breast when you flex your pec muscles. To some degree, everyone's gonna have a little bit of that. I mean, go to the yoga studio, you're gonna see plenty of it. And a little bit is fine, a lot is not. But you'd expect that because the implant is sitting partially under the muscle, so when the muscle flexes, it can push the implant a little bit. When it becomes a obvious issue that even with minor movements you have a lot, then that's something that we would want to revise. But by and large, when you take into account that durability and that smoother contour at the top, that explains why in North America we've become very biased towards under the muscle. In other parts of the world, above the muscle is more popular. The advantage of that is that it's a shorter recovery, although I personally haven't found that to be a significant issue, and you can take out the issue of the animation deformity. The other time, though, where we might want to go on top of the muscle is when people need their tissues to stretch more. Certain breast shapes, for example, may actually do better going on top rather than underneath. There are some kind of hybrid approaches, something called the subfascial approach, which has not really gained the kind of traction that some of the advocates might have hoped for, but I think that the above or below are the two you see most commonly.